Hi, my name is Meg. I am not a doctor, and please do not take any of my advice or suggestions as medical advice. I am not a medical professional. I am a mother of a child that has PANS, and I'm just here to help spread awareness and to tell you guys a little bit about what PANDAS and PANS is, um, and uh, basically help you if your child is suffering from pandas or pans, to kind of navigate the system and figure out how to get treatment, find doctors. And if you don't have a child that's sick, I just want everybody to be aware of the symptoms and signs of pandas and pans. So if your child does get sick, or if you know someone that you hear of has these symptoms, you can refer them to a medical professional. So pandas and pans. These are acronyms that stand for PANDAS is pediatric autoimmune neuropsychiatric disease sorry, associated with strep. Sorry, I got a little cold. And PANS is pediatric acute onset neuropsychiatric syndrome. Sorry. Um, so what these are an autoimmune disorder that are caused by a regular infection. With pandas, the trigger is strep throat. Um, I say strep throat, but actually strep can hide in all parts of your body. I did not know this before my son was diagnosed with PANS. You can get strep in your sinuses. You can get it in your throat. You can swab for it in your bum. It can hide all over the place. So I say strep throat, but it's really just the streptococcal bacteria. And PANS, the trigger could be any kind of infection. So it doesn't necessarily have to be strep, but the trigger for both of them is some kind of infection. And then you will see a sudden onset of changes in your child's behavior. You'll see symptoms like OCD. You'll see maybe you'll get tics, or your child will get tics. Some have hyperactivity. Some have motor movement disorders, where they can't hold still and they move their arms and their fingers. Some have sensory disorders, sleep problems, bathroom potty problems, um, rage and aggression, tantrums, pretty much any kind of neurological symptom they could experience when they have a flare. And we call flares when they have an infection that causes this autoimmune reaction. The parents call them flares. Now, my son was a little unusual. He had his onset at a really young age, which made it very hard to diagnose. He was 18 months old, and for a child that is typical, it's usually closer to 3 and over, more in the range of like 5 and 7 years old when people have their onset. So when a child like mine has his onset at 18 months old, it's very difficult to see developmental regression because things like separation anxiety or sucking your thumb or having meltdowns and tantrums are totally age appropriate. They also don't have their verbal skills set in place so that you can see a reduction in talking. You could a little bit, but not much. Um, he most of the time would, when he would have a flare, be very aggressive towards, he has a twin brother, which actually helped in diagnosing him. He has a twin brother who he often would take his aggression out on, and myself. And he would hurt himself. He would bang his head into the wall. He was very hyper. Um, Sometimes they get large pupils. It's like they look like they're kind of like terror stricken, and their pupils are really big and dilated, even in good daylight, and it looks really weird. Um, So sometimes he would have that. Um, anyway, I just thought, okay, I think he can't talk very well. He can't tell me what's going on. Maybe he's hurting. Maybe he has an ear infection. So I started taking him to the doctor whenever he would do this. And every single time, we would either find an ear infection, a sinus infection, or strep throat. And we'd put him on antibiotics, and the symptoms would go away. And I was like, oh, okay, that's just how my son tells me when he's not feeling good. He hits himself and bangs his head into the wall and attacks his brother. I didn't understand it, but he just seemed to do that every time he got sick. And the antibiotics would kick in, and overnight he'd be back to normal and be a happy boy that would play with his brother and talk and not hit things or hit himself. Um, After months of this, where we would go off the antibiotics, and within about 5 days to 7 days, he would start showing symptoms again. I'd take him back in, we'd go on antibiotics, and we did this for probably 6 months. This kind of up and down roller coaster. And I started asking my pediatrician, are there things that kids can get where they just have to be on antibiotics all the time to function properly? Because I just didn't understand this. Like, I don't know what's going on, but it seems like the only time he's my happy little boy is when he's on antibiotics, and I couldn't explain it, and my doctor couldn't explain it. So we decided to go to an ENT, even though at this point he was only two and a half maybe, and because he had had so many repetitive um, strep throat cultures, um, that we decided to take his tonsils and adenoids out. He also snored really bad. So we took his tonsils and adenoids out. He was on antibiotics at the time because he had had a positive strep culture 2 days before surgery. He was on his antibiotics for 2 weeks after, and it was like the lights came back on. It was like my son was back, and we at this point had already put him into behavioral therapy programs, and up until this point he was not working with the therapists. He just kind of ignored them or was aggressive towards them. And after getting his tonsils and adenoids out, he was like a different kid. He was just happy again. He'd participate in therapy, played with his brother, was just the sweet little boy that we knew and loved before all this started happening. And I thought, great. He was just sick and not feeling good, and we fixed it. We got his tonsils and adenoids out. He's feeling better. Now we just have to get him caught up, and he's going to be great. Well, little did we know that that was not the end of our story. About 3 or 4 months later, he got another strep infection. Yes, you can get strep without tonsils. So he got a strep, and all the symptoms came back overnight. And I was like, what's going on? Why is this happening again? We took out the tonsils and adenoids, and this seems to be kind of seasonal because over the summer he got his tonsils and adenoids out kind of at the beginning of the summer, and through the summer he was great. And then all of a sudden fall rolls around, he gets strep, and suddenly he's a lunatic again. So I talked to my doctor. He didn't know what to tell me. He thought, okay, maybe it's a seasonal allergy or something. So he refers me to an allergist and an infectious disease specialist and a neurologist, and we just start going from specialist to specialist to specialist. And we, in the course of the next year, saw 15 different specialists, and all of them basically said, I don't know. It looks like he has autism. He has red flags for autism because he was in these rages and going nuts and having meltdown tantrums. He was now very verbally delayed. And I just want to add that he has a twin brother. Up until his onset at 18 months, he was developing ahead of his brother, like a month ahead. He crawled first, he rolled over first, he sat up first, he talked first, he walked first, everything. And then 18 months hit, he had his onset, and he just fell behind and just got left in the wind. So he is now very developmentally behind, which is another red flag for autism. So people just start saying, okay, this mom, just doesn't want to admit that her child has autism. That was not it. I was okay with saying, okay, he has autism if you can explain why when he's on antibiotics, the symptoms go away. No one could explain it. So we saw an allergist who tested him for allergies like crazy, and he was allergic to nothing. And the allergist said, I don't know if you've ever heard of this disease. It's kind of controversial. It's not very well known. It's called PANDAS. He said, I think that your son has PANDAS, and I think you need to look into it. I went home, I Googled it, I read about it, and I thought, this is it. This is what my son has. And we again started going from doctor to doctor, trying to find someone that knew about PANDAS and could diagnose and treat him. That was another journey that took another year. We finally, thankfully, have a team of doctors that are amazing. And after a year of working with them and ruling other possibilities out and having intensive ABA therapists in our home for a year who basically look at everything he does, they chart and do analysis on every behavior. So we can actually take in a graph of his different behaviors when we go see a doctor. We can mark the dates when he was sick, and you can totally see that it goes up and down every time he gets sick. His behaviors go up, and then when he goes on antibiotics, they go down. So after a year of cataloging and putting down all this data and taking it to the doctors, they were like, okay, we see what you mean. And they had also seen him in a flare and then also seen him as he was doing well and saw it for themselves. And that was finally what did it. And that's kind of our journey with figuring out that my son had PANDAS. So when you look at these signs and symptoms, like OCD, you think, okay, they're going to wash their hands repetitively, or they're going to be, obsessed with lights and doorknobs and things. And as my son has gotten older, he has done those things. He's, been obsessed with keeping the lights on. He's been obsessed with wearing certain clothes or wearing no clothes at all, or wanting to take showers over and over again. But when he was 18 months old, I don't think he was developmentally capable of having fears and obsessions like that. So his compulsions were aggressive compulsions. If you think about what a 2-year-old is capable of, what they know, and what they might be compelled to do, most 2-year-olds are kind of crazy. They have tantrums and meltdowns, just a normal 2-year-old does. And they can be aggressive and not want to share. And just think about that with an obsessive compulsive mindset, and you can see why it would be hard to diagnose at that age, because the things they're obsessed with and compulsive about aren't easy to notice, because they're just like a 2-year-old but on steroids, just extra crazy. So you go in and people say, oh, your kid's got the terrible twos, and you think, no, this is not the terrible twos. He has a twin brother. I know what the terrible twos look like, and this is not the terrible twos. My son has something wrong with him, and antibiotics, for some reason, take it away. So I urge you, if you have a child that has had a waxing and waning of symptoms that coincide with infections or sicknesses, even viral infections affect my son. So every time he gets a cold, we'll have kind of a mini flare. Seems like bacterial infections are always the worst. Strep especially is bad and lasts the longest and is hardest to get rid of. But if you have any of those symptoms, or you just want to check and see if your child has the possibility of having PANDAS or PANS, because it is very often misdiagnosed or not diagnosed ever. If you ever see a sudden change in your child in their behavior or their personality, instead of going to a psychologist or psychiatrist, go to your family physician and ask them for a throat swab, a sinus swab, and a checkup. Look for infections. You can do blood tests and look for what they call titers, your level of titers, and it's basically your level of antibodies for a certain infection, and they can test for that. And if your antibodies are super high, then that means that you have had a past or present infection for like strep or pneumonia or different things that can be triggers. Test for it, and if you find signs and you put them on antibiotics and you see improvement, then follow your gut. Again, I'm not a doctor. I'm just a mom. I'm trying to help the next person that goes to the doctor and thinks, what is wrong with my child? Because it took me 3 years to get to where we're finally getting treatment and seeing some real progress in my son. And I think that's far too long for any child to suffer and any family to suffer, because it really does affect the entire family. And it's heartbreaking. It is. It's like you see these glimpses of your child, and you feel like they're coming back to you, and you feel like any minute the bottom's going to drop out again and you're going to lose them and they're going to go into their world and shut down. So anyway, I hope this is helpful for someone. If not, maybe I'm just talking to myself, but if you're watching this and you want to help me spread awareness, feel free to share my video. Please subscribe to my channel and share any videos that you would like, and help me to teach people about pandas and pans, and spread the message. So thanks.